तुम तो नहीं आओगे? Good afternoon, everyone. Am I audible? Can one of you unmute yourself and tell me if I'm audible?
Yes, you are audible.
Okay, thank you, ma'am. And I thank you all for coming here and for your patient waiting. We will begin very soon. In a minute or so, we will begin. Very good afternoon, everyone. I welcome you all on the behalf of Dr. Rohit Bhandari, the founder and director of the Homeo Healers Homeopathy Worldwide. And this is our second webinar session in our webinar series, which is held twice every month. And this is the second webinar of that session. And our first presenter speaker, Dr. Vasundhara Mehrotra, has joined us. And I would like to introduce her to you all, and then she will begin the session. Dr. Vasundhara ma'am has a clinical experience of over 17 years. She is currently working as Assistant Professor, Department of Repertory and Case Taking at Solon Homeopathic Medical College and Hospital. She is skilled in handling difficult cases with homeopathy. Dr. Vasundhara is also associated with Vedanta Hospital, Panchkula for homeopathic OPD. She is the ex-editor of Homeobuzz, a monthly homeopathic pharma journal. She has published 10 articles in reputed homeopathic journals. Ma'am has also presented a research paper at National Homeopathic Conference in Jaipur, organized by HMAI in December 2024. These are just some of the achievements with so many more left. Thank you so much, ma'am, for giving us time today, and we are looking forward to hearing from you, ma'am. Ma'am, over to you. Please unmute yourself.
Good afternoon, everyone.
Good afternoon, ma'am.
Thank you, ma'am, for such a wonderful introduction. And I would surely try to share whatever I have uh, with me in my, uh, with my work and with my experience with all of you today here in this webinar. And I'm really thankful to Dr. Rohit Bhandari sir and the entire team of the Homeo Healers Homeopathy Worldwide for this opportunity. Thanks a lot.
Thank you so much, ma'am.
Yeah, ma'am, I would like to share my screen. Just to give me a second.
Yes, ma'am.
The message here displayed is that I don't have the permission to share the screen. How to change this, please? Can someone guide?
Ma'am, okay, I'm just looking into it.
इस पर क्रिएट डेटा दिए फॉरवर्ड की हाँ 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 इस पर व्हाट्सएप पे हाँ इस पे ये।
Ma'am, is it still showing the same option?
Yeah, actually, I'm working on it. This is, you don't have permission to share content in this meeting, it says. I'll try to log in once again. I'll log out and log in again.
Okay, ma'am.
सबके पास में जैसे इस बटन को प्रेस करेंगे शेयर तो उसके बाद उनकी स्क्रीन आ जाएगी वहां से वो शेयर कर सकते हैं
Okay. Dr. Sneha, can you hear me?
Pardon, ma'am.
Yes. Sneha, can you please try to share your screen? The option is beside the mute button. There's an arrow there. No? See if you are able to
Yes,
share the
ma'am.
screen.
Okay, ma'am. No, ma'am. There is no
You
option for the participants to share screen.
okay?
I think the organizing members only have the permission to share the screen. I am not getting this, you know, option here, neither on the laptop nor through the phone.
Dipali ma'am, please transfer the admin setting to the speakers.
So basically, I have logged in through my first. I initially logged in through my ID only. Now I have logged in through my husband's ID. Still, it is not sharing the. It's not allowing it allowing me to share the screen as such. One thing I can do, I can share the presentation to Dipali ma'am, and she can share it on the screen if that option is available with her. Hello.
Dipali ma'am, are you there in the meeting?
I can share the presentation to someone who has this option to share it on the screen. Hello. Is my screen visible now?
Yes, ma'am.
Okay, so should I begin, ma'am? This is my presentation, and this is actually a part of what I have been doing in my PhD research work as well. So I have been exploring the homeopathic perspective of deficiency disorder. So I'm really, really glad to be amongst all of you today and be able to, share some of my findings with you people. So we all know about the various deficiency disorders. I will be like starting away straight away with the biochemistry of health. Right. So when we talk about the biochemistry of health, we all know that the entire mechanism, all the functions, all the daily functions that our entire system, carries out, depends upon some very subtle and very essential chemical processes. And all these chemical processes are like they come under the main domain of biochemistry. These chemical processes, our entire metabolism depends upon these chemical processes. So probably there are now like 30 elements which have been ascertained by different scientists and investigators, which have been found to be very, very extremely essential to the physical makeup, the physical construction of our bodies, and in maintaining healthy functions through the biochemical processes as reactants, catalysts, or products. See, this is the topic deals with deficiencies. So to deal with deficiency, we have to first understand what is the definition of, fullness, or where there is no deficiency, what is the definition of health per se in terms of biochemistry as well as in terms of homeopathy that we will look ahead. So this was the biochemistry of health. Then let's see the biochemistry of nutrition. Our body absorbs nourishment from food in the form of macronutrients and micronutrients. This is what we all very well know about. So the macronutrients, we all know the proteins, the carbohydrates, and the essential, all those fats. So they are the energy giving, the body building part of the nutrition. But then there are micronutrients also. They are required in very, very small quantities, but are indispensable for health. Now, the entire thing, even if we, take the proper portions of our daily recommended, macronutrients, but if these micronutrients, which are required in very, very small quantities, if they are lacking or their balance goes out of order, the processing of energy from these macronutrients will also get hampered. These micronutrients are vitamins and minerals, which we all know. These vitamins and minerals play diverse roles as hormones, signaling molecules, coenzymes, and they facilitate a range of biochemical processes for our living functions. Here I am sharing with you all a list of certain vitamins and certain essential minerals, and their chemical names, their formulas, and their major elements which go into the formulation of these vitamins, which are the building blocks of these vitamins, and the imbalance of these minerals, these small quantities of these minerals results in deficiency diseases like night blindness, beriberi, anemia, and whatnot. As we can see, vitamin A, the chemical name is retinol. The chemical formula C20H30O, carbon, hydrogen, oxygen. As you can see, all the vitamins from vitamin A to vitamin K, whether be it a water-soluble vitamin or a fat-soluble vitamin, the basic elements that go into their formulation are carbon, hydrogen, nitrogen, and oxygen. अब इनके कॉम्बिनेशन में कहीं पे फॉस्फोरस है, कहीं पे कोबाल्ट है, कहीं पे सल्फर है, कहीं पे क्लोरीन है, एंड उसके हिसाब से ही इनके functions भी डिफर कर जा रहे हैं because of the nature of the element that goes into the formation of that vitamin. Then we see the minerals. This is the text table is of the mineral kingdom, the minerals which are like, which are required by our body in very, very micro quantities, be it calcium, iron, iodine, magnesium, phosphorus, potassium, sodium, zinc, copper, selenium, chromium, manganese, fluoride, etc. And all the various key functions which they affect or which they are capable of, modifying. So we see calcium here. It is required for bone and tooth formation, muscle function, nerve signaling, and its deficiency, very well you know that it leads to rickets in children and osteoporosis in adults. Now, the deficiency diseases which are displayed here are the ultimate outcomes of the deficiency. Now, there is a process that goes into the development of rickets and osteoporosis. That process involves, development of certain signs and symptoms which show that yes, your body is lacking in calcium, your body is lacking in iron or iodine or magnesium. Iron, as you all know, iron deficiency anemia results from the deficiency of iron. But before what all things happen to the system, they appear in the form of symptoms like, excessive chilliness, then weakness, and then altered appetite. All these symptoms which go into the process of this development of final outcomes, be it goiter, be it arrhythmias, be it hypokalemia, hyponatremia, growth retardations, skin lesions, anemia, bone issues, etc. and etc. Now let's move on to another aspect of deficiency. Yes, I have talked about the biochemistry of deficiency. I have talked about the basic deficiency disorders that result from all those vitamins and minerals. And if these go out of order, even the macronutrients won't be processed properly, as we see in diseases like kwashiorkor or marasmus also. So when we talk about deficiency from a homeopathic perspective, deficiency is essentially the failure of nutrition to nourish the body for a healthy living. Very simple. That is nothing that we don't know about. But the point which we are discussing here is why the nutrition fails to nourish. We drink milk, but our bones lack strength. We eat plenty of vegetables, greens, but the blood lacks the essential vitamins. There is a craving for proteins, chickens. Still the muscles lack fiber and they are not strong enough. So like this, despite the fact that the nutrition is taken, it is in the form of wholesome meals, the body fails to assimilate them. So this process is the target, is the topic of today, which I'm going to discuss here. So why does it happen altogether? So why, when we talk why, we have to discuss about the cause. We know that Dr. Hahnemann has said in Aphorism 3 about the knowledge of a physician. I don't have to actually tell you about these 7 maxims of knowledge that the physician ought to have in order to deal with any case of disease in his or her clinical practice. We have to have a knowledge of disease, knowledge of medicinal powers, application of drug knowledge to disease knowledge. We ought to know the knowledge of how to choose a remedy. We ought to know the knowledge of exact mode of drug preparation, the proper dose and repetition, and the obstacles to cure. So the topic here deals with deficiency. We will talk about the first maxim of knowledge, that is the knowledge of disease here. When we talk about knowledge of disease, we all know that Dr. Hahnemann has given a classification, a broader classification with the types of diseases. He has categorized diseases into indisposition, surgical disease, dynamic diseases. Now, my question to all of you present in this meeting today is, in which category will we keep these deficiency disorders? Anyone can just share his or her point of view, please.
Indisposition.
Okay. I cannot see the name of the person responding. Can you please tell me your name also?
Dr. Purvi Desai.
Okay, indisposition, right, ma'am? Okay, fine. Anyone else? Why indisposition? Can you please also justify with some, supportive sentence? Why indisposition?
Like indisposition is where the position is not in the right place. The person is just deranged with some or the other cause which can be removed, and then the like the indisposition definition says, if we rectify the cause and which is just kind of maintaining, the symptoms just disappear. So same with the deficiencies, that if there is, like, for example, vitamin D deficiency, pain in bones or like muscles, if we give the supplements to the patient is recovered with the symptoms. He or she
Yeah.
doesn't have the symptoms again. Like,
Yeah, I totally agree with you. In this particular instance, yes, it is indisposition, wherein once you replenish the nutrients, the symptoms go away, right? You replenish the person with a healthier diet option, and the symptoms go away. But then there are certain cases wherein howsoever good diet you provide to the person, howsoever good living conditions you provide to the person, the symptoms won't budge. Or even if they reduce, for instance, that would be just a temporary finding. So yes, truly, yeah, we can, as the next slide goes in, where do deficiency disorders fit? Are they indispositions or they are dynamic diseases? So indisposition is one of the possibilities. Definitely a person born with a robust constitution, if by circumstantial causes the person fails to get that much of nutrition and develops symptoms, definitely it is indispositions. But then I have found in my experience, clinical experience, as well as this research experience, there are persons who were taking a very good diet and leading a really good lifestyle also, plenty of sun exposure. Still, when we went in for the checklist of finding out whether or not they are suffering from the deficiency of vitamin D, we found that yes, they were still having vitamin D deficiency in their system. So in that condition, I would keep these kind of conditions in dynamic diseases. Dynamic diseases, we all know, like they are the true diseases that we deal with in homeopathy, acute or chronic. Now, when we talk about dynamic diseases, I hope this is very obvious that uh, the deficiency of vitamin D basically is of chronic in nature. Not only vitamin D, any sort of deficiency, be it iron deficiency, be it magnesium deficiency, be it vitamin A deficiency or whatsoever deficiency, these all are like they have a very insidious onset. They run a longer course and they begin with initial functional symptoms, and over the course of time, if the deficiencies are not addressed to, they may result in overt disease conditions also. So yes, this can fall into indisposition or dynamic disease, any of the case as may be. So dynamic, here what I am discussing is a dynamic cause of deficiency. What I'm going to discuss here with you all is the dynamic cause. Deficiencies show chronically evolving features in the system, are dependent on the fundamental cause. Now, here I'm specifically talking about the chronically evolving features. So let's look into the fundamental cause. What are the fundamental cause? As we all know, are the miasms, which have been given by Dr. Hahnemann himself. So there are n number of definitions of miasms. I have taken only one, that is polluting exhalations. So polluting exhalations, why I took, because see, if we go and dig deep into the definitions, there will be n number of perspectives that have to be discussed. Here I am discussing or trying to put up one aspect of miasm that leads to chronic conditions based on deficiency disorders. So here I took this word polluting exhalations. Polluting, as we decipher, introducing harmful substances into the system. And exhalations, substance which are given off like thrown out or emanated. Now polluting, अगर हम बात करते हैं, polluting is something जो कि किसी भी चीज का नेचर को एडल्टरेट करे. अब चाहे वो सिस्टम हो, ठीक है, चाहे वो कोई सब्सटेंस हो. Now since we are talking about nutrition, we are talking about our metabolism, and there are certain harmful substances which develop into our system. The system which is based on the tissues and the basic building blocks, the cells. So there's a perspective that you introduce a harmful substance. Now, why I have written in the bracket developing? Because it is not necessary that every time we introduce certain injurious substance into the system, there are times when the system itself develops harmful substances, which it fails to, excrete out or discharge out of the system. In that particular condition, that harmful substance will become injurious to the person and lead to certain conditions. Now, what can be the triggers like stress, fears, anxiety, greed, jealousy, anger, etc.? So these are those conditions, those triggers which lead to the development of harmful toxins into the system. And if the system is not robust enough, is lacking already at the baseline, at the construction, fundamental line, so these toxins won't be, given off, and they accumulate into the system, leading to all sorts of functional errors. So I tried to, read about this theory and all the related theories. I have taken this content from various books. So Dr. J.H. Allen has talked about this thing, Virchow's cell theory. He says he has compared Dr. Hahnemann's chronic miasms to the theory of chronic miasms to Virchow's cell theory also. I tried to figure it out, and what I figured out, I'm presenting here. So Dr. Rudolf Virchow, he was a German physiologist, and in 1858, he comes up with a cell theory, which says that all cells arise from pre-existing cells. Now, it depends upon the environment of the pre-existing cells, the basic nature of the pre-existing cells, that how the progeny is going to be, or how the resulting cells which come out of the existing cells will be. So diseases arise from cellular changes. Cellular changes at what level? At the genetic level. Why the genetic level? Because there is a condition of stress which this cell undergoes, और उस stress की condition में cell adapts. वो जो adaptation है, that the cell retains as a memory. And when this cell divides, it retains this memory and transfers it to its, further multiplied cells. So as cells divide, this disease also propagates as a memory of adaptation under stress. The disease here is failure to assimilate. Failure to assimilate what? What is already available. What is available, but the cell is unable to assimilate under the condition of stress. And this memory gets, transferred through successive reproduction of the cell and leads into a transfer of the miasm called sora. The system fails to get rid of unwanted results of stress and adapts to these failures, which gets coded into its genes and transfers to progeny as oversensitivity. And we all know that oversensitivity is SORA. This is something which we have already we all homeopaths know about, that SORA is hypersensitivity, oversensitivity to the normal, that breeds stress, a state where the system demands more than the normal, and the normal is resisted into the system. ये जो एक सेंटेंस यहाँ मैंने डाला है, इसको डॉक्टर हर्बर्ट रॉबर्ट्स ने इस तरीके से एक्सप्लेन किया है कि when you are in stress, there may be like, say, I am in stress, you are in stress, but our systems respond differently under the condition of stress, which depends upon our basic construction. What is lacking into our system, that that particular mineral or that particular substance, उसका एक डोमेन है, उसका एक स्फीयर है, वो स्फीयर ही उस स्ट्रेसफुल कंडीशन में कहीं ना कहीं जाके हिट करता है. Supposedly I lack, in say, as we see that I lack in a mineral like, say, argentum nitricum. Let's talk about argentum nitricum, that is silver nitrate. So silver nitrate is what? Silver and nitrogen. And what we read in Allen keynote, that ailments from prolonged mental exertion. Prolonged is the key word. Prolonged means what was expected, उसके ऊपर उसको mentally exert करना पड़ गया. यानी कि उसको अपने stress जो है किस चीज के, silver nitrate के, what these two things do, they impart strength to the nervous system and the सेंसरी सिस्टम. तो कहाँ पे, वहां पे वही उसका कोर है अर्जेंटम नाइट्रिकम का, और वही वो जब स्ट्रेसफुल कंडीशन में आता है तो वो स्टोर्स डिप्लीट हो जाते हैं, एंड दिस पर्सन डेवलप्स ऑल सॉर्ट्स ऑफ एंजाइटीज एंड न्यूरोसिस, which are like, as we see ki, even the gait is trotting and cannot walk with eyes closed, and there is even paralytic conditions. There are like there is diarrhea from on going to the opera and all. So the system fails starting from the nervous center. Why? Because silver nitrate feeds the nervous center. So this is what I'm saying. This sentence that SORA is oversensitivity and stress, under stress, the system demands more than normal. जितना होता है already normal है, उससे ज़्यादा system की requirement हो जाती है, जो कि available नहीं हो जाती है, और deficiency ना होते हुए भी system में deficiency create हो जाती है. और इसी के साथ में गट टिश्यू में चेंजेस आते हैं. गट टिश्यू, अगेन द सेल्स ऑफ द गट एंड द गट माइक्रोफ्लोरा आल्सो चेंजेस, लीडिंग टू इनसफिशिएंट एब्जॉर्प्शन ऑफ न्यूट्रिएंट्स हैं डाइट में. ऐसा नहीं है कि नहीं है. इंडिस्पोजिशन वाला हमने कंडीशन यहाँ पे नहीं डिस्कस कर रहे हैं. वी आर डिस्कसिंग अबाउट द क्रॉनिक प्रोसेस ऑफ क्रॉनिक डिजीज. तो न्यूट्रिएंट तो है डाइट में, बट सिस्टम उसको एब्जॉर्ब नहीं कर रहा है, रेजिस्ट कर रहा है. Now, here are some of the views of the stalwarts. There is some essential failure of the system to assimilate the necessary constructive materials that provides the background of the so-called soric changes given by Dr. Herbert Roberts himself. Then, this is entirely, this concept, since it resonates with deficiency, I have taken from Roberts only, and he has mentioned about the work of Dr. Boning-Wasson also. Hahnemann's chronic diseases talks about miasm, and Boning-Wasson indexed his work, the first systematic alphabetic repertory of antisoric drugs given by Boning-Wasson. He listed 50 antisoric remedies, and out of these 50 antisoric remedies, 33 were the elements or inorganic substances. The elements and their salts correspond to the micronutrients whose deficiency produces chronic diseases. तो कहीं ना कहीं एक तो ये चीज हुई कि जो बेसिक एलिमेंट्स हैं, ठीक है, तो उनकी whatever goes into our system, be it in the form of vitamins or all the building blocks in the cells, ये सारा बना तो available जो earth की surface में जो elements है उन्हीं से बना हुआ है. And the way we are made up, एक तो constructional defect है, और दूसरा under the state of stress, जैसे मैंने अभी अर्जेंटम नाइट्रिकम का एक एग्जाम्पल शेयर किया था, तो अंडर द स्टेट ऑफ स्ट्रेस जो ऑलरेडी एग्जिस्टिंग स्टोर्स हैं वो भी कहीं ना कहीं एग्जॉस्ट हो जाते हैं, द पर्सन गोज इनटू अ स्टेट ऑफ डेफिशिएंसी. These are the 50 antipsoric drugs which have been given by Dr. Bonigosson. As you can see, all the green ones are the plant remedies. Sepia is the only animal remedy, and the rest 33 in the blue are the minerals. Minerals, the alumina, ammonium carb, ammonium mure, arsenicum album, auromate, baryta carb, boric acid. We can see all these 33 elements and their salts, they go into the formation of antipsoric drugs. So here what I want to underline that what Herbert Roberts has also written, that SORA or deficiency are one and the same thing, or they define each other. So now here is a case which is also a part of my study only. And this is a case I have taken from my pile of the study group suffering from vitamin D deficiency. The patient is a male, 21 years, unmarried, from Solon, vegetarian, and a student. The present complaints, let's see what are they. Weakness and lethargy. Walking even 10 steps was difficult. Body pains on slightest exertion. Chronic nasal catarrh and forgetfulness. So we all know deficiency of vitamin D results in defects in bone mineralization, leading to widespread bone pains and muscle weakness. Vitamin D deficiency has also been linked with multiple sclerosis, which can also cause numbness, weakness, trouble walking. That is one aspect of another aspect of vitamin D deficiency. Although, as I said, कि ये एक chronic process है. तो to begin with, इसी तरीके के weak symptoms आ रहे हैं, reduced immunity आ रही है, weakness आ रही है. Then the immunity is lost at multiple levels, not only at the respiratory tract, even at the digestive tract, at the level of skin and hair. So at the level of skeletal system, weakness is there because vitamin D is that catalyst which, which facilitates all the other functions of that basic tissue. तो वो वहां से मिसिंग होता है. चाहे आप देखो एक विंटर्स में आता है सीजनल अफेक्टिव डिसऑर्डर. So what it is, basically vitamin D is very much necessary for the release of dopamine. और जब भी विंटर्स के टाइम पे होता है ना कि कई कई दिन तक सन एक्सपोजर नहीं मिल पाता है लोगों को, either because of too much of covering या फिर sun ही is hidden under the clouds. So that, produces, a very depressive mood in the patient because of ultimate lack of dopamine. तो एक तो मूड लिफ्ट नहीं हो पा रहा, साथ में विटामिन डी की कमी से क्या हो रहा है, there are pains here and there in the body. The patient goes into a state of depression, which is also termed as seasonal affective disorder. So vitamin D deficiency has been linked with cognitive decline and executive dysfunction. When we are, as I talked about dopamine, forgetfulness, तो cognitive decline भी करता है, उसका जो भी आप कर रहे होते हैं, whatever daily course that you perform, so उन सबको करना भी कहीं ना कहीं it becomes cumbersome in the absence of vitamin D. So basically, this is the Bonigosson module, wherein I have divided the complaints of the person into location, sensation, modalities, and concomitants. There was weakness and lethargy. There were body pains. There was nasal catarrh. There's forgetfulness and absent-mindedness. So nasal catarrh दो level पे affected होता है. इसका B12 I have not shared. Even that was quite low, and the vitamin D was also low. तो कई बार अभी आप देख रहे हैं कि जो पेशेंट्स हैं उनको एक सेट ऑफ कंप्लेंट्स आ रही हैं, एंड व्हेन वी आस्क देम टू गेट देयर टेस्ट डन, दोनों ही कहीं ना कहीं आपके लो आ रहे होते हैं. एंड आई हैव पर्सनली सीन कि ये किन में कम आ रहा होता है? जो कि already who are on diet, like who are non-vegetarians, who take regular milk, and still this thing is coming in. In fact, जो कि कई सारे ऐसे जो वेजिटेरियंस हैं उनमें आपको B12 और विटामिन डी कहीं ना कहीं आपको नॉर्मल रेंज में फिर मिल जाता है. बट जो नॉन वेजिटेरियंस हैं, दिस इज व्हाट आई वाज टॉकिंग अबाउट, कि डाइट तो अच्छा है तो क्यों नहीं बॉडी एसिमिलेट कर रही है. So the history of presenting complaints: he was obese earlier, like in 11th class. Thereafter, he joined gym and started dieting and taking protein supplements. He went on some sort of weight loss diet. Thereafter he started feeling weakness. अब यहाँ पे कहीं ना कहीं एक ट्रिगर मिल गया कि डाइट पे जाता है. Maybe I don't know what kind of diet it was that led to some sort of imbalance into the system, and this person started feeling weakness along with frothiness in urination, which followed dieting and weight loss. He also complained about frothiness in urine. He said कि when I pass the first urine of the day, it is quite frothy.
I request all participants to kindly keep yourself mute. Please check yourself if you are unmute.
That is a horrible card to use. We decided to shift the cards again. Found out.
So along with weakness, body pains on exertion also started, settling in. Nasal catarrh was there ever since he was a child. He used to breathe through mouth only. This got better as he grew up. Then there was absent-mindedness. He said, yes, I used to stay mostly. The teachers also complained that the concentration is not proper and not paying full attention in the class. He had a past history of chickenpox at 7 years of age, chronic nasal catarrh in childhood, obesity during puberty. So chickenpox, again, it's an eruptive fever, and it is, we all know कि ये acute conditions होती हैं. ये usually अपना क्या होता है, latent सोरा का एक तरीके का explosion होता है, which is already there in the background. Now the family history: this person carries a family history of degenerative bone disorders. His grandfather, grandmother, aunt, uncle all underwent knee replacement. He has hypertension in the family history. He has diabetes and asthma also. Diabetes, his father has, his uncle has, aunt and grandfather, and his mother is asthmatic. Personal and social history surrounding at home are good. Tea or sugar ka thoda sa habit tha, which I asked him to put off, and he agreed to it. Exercise, infrequent visits to gym, history of obesity that I have already talked about. He has a good appetite. The thirst is also good, 3 to 4 liters. Otherwise, it is out of habit, basically. Thirst उतनी ज़्यादा नहीं है. हाँ, ये out of habit ही ये इतना intake होता है water का. Otherwise, thirst कम ही है. Food, pain in stomach from eating corns or cornmeals. Corn is a starch, so starch is disagreeable. Bowel, stools regular without any discomfort. As I said, first urine after rising in morning used to be frothy. Sweat normal, but more on face. Sleep disturbed. Cannot sleep on time, falls asleep around 3 a.m. and then wakes up late without much energy and freshness. Thermally, this person is chilly. He wants layers on layers in winters and Solan, as you all know. वैसे ही जो winters हैं वो extended होते हैं, and this person carries thermals up till like even March, also March and April also. Bathing, easily skips 2 to 3 days during very cold weather. Wants to cover up especially feet which remain cold most of the times. Then mental generals, depressed, confused about his own self. Introvert, feels shy and cannot easily start communication. Absent-minded, forgets where he has kept things, and he is very, very sensitive to the opinion of others. He rather started dieting or going to hitting the gym or out of this basic fear that like people started, he used to think that my friends are making fun of me and I don't want to appear in public places. He used to avoid going into gatherings and the parties, in family gatherings, etc. He's impulsive. He doesn't think much before acting, doesn't forget issues easily, keeps them in heart. This is the case analysis, the mental symptoms, the physical symptoms, and this is the miasmatic analysis. The weakness on exertion, energy is lacking, is SORA. Body pains on exertion, rest desire. SORA needs a lot of rest. Lot of rest, why it is desire? Restless भी है और rest भी ये desire करता है. इसलिए करता है क्योंकि again जो बेसिक इकोनॉमी जो इसकी डेफिसिट में जा रही है वो जा रही है मेटाबॉलिज्म. जब ये मेटाबॉलिज्म लैक करेगा तो कहीं ना कहीं उसको कोल्डनेस है सिस्टम में, तो उसकी वजह से वो रेस्टलेस है. कोल्डनेस को उसको ओवरकम कम करना है, लैक ऑफ वाइटल हीट है, तो इस वजह से रेस्टलेसनेस तो है, बट मूवमेंट मेक्स हिम वर्स बिकॉज ही इज ऑलरेडी अंडर डेफिसिट. तो उसको रेस्ट चाहिए, as we find in sulfur. Then absent-minded is largely syphilis, impulsive, syphilitic. Introvert is both SORA and psychotic. Depression and sadness, syphilitic. Keeps things in heart. Although depression and sadness इसकी इंटेंसिटी के हिसाब से ये है कि ये सिफिलिस में डाला है. Even depression can be soric as well. Keeps things in heart, dwells on them, psychotic. Sensitive to opinion of others, soric. Coldness of feet, soric. Appetite, ravenous. Obstruction of nose, discharge. Aggravation, cold air. जितनी भी कंडीशन है सारी इसकी कोल्ड से एग्रेवेट कर जाएंगी. Obstruction of nose, basically this is again psychotic. यहाँ पे उसका थोड़ा सा टाइपो एरर आ गया है. Then totality of symptoms. I've taken most of the physical generals: weakness and lethargy, body pains. The mental generals: absent-minded, impulsive, introvert, depression and sadness, keeps things in heart, dwells on them, but sensitive to opinion of others was one very prominent feature here. Coldness of feet was prominent. Sweat on face, appetite, ravenous, obstruction of nose, aggravation, cold air, discharge, aggravation, cold air. This is the repertorial sheet of the case. As you can see, we get a number of medicines, but yes, here calcarea carb is standing out, covering almost 11 symptoms out of 11 rubrics out of the 12 taken on the repertorial chart. The analysis of repertorial result has been given here. The patient had weakness as a chief complaint, so much so that it was difficult to walk even for a little distance. His thermal reaction was chilly and had sweat on face and coldness of feet. He had very low vitamin D levels despite a good appetite with intake of half a liter milk almost every day. The medicine prescribed was calcarea carb 30 once on alternate days for 30 days. See, the potency and the repetition is based on the purpose. Like this is a part of study. So these are the results. As you can see, 7th of December 2023, this case came into the study group, and this is the vitamin D levels, 8 nanogram per ml, right? So this comes under deficiency. So on 12th of March, that is almost 3 months after, not significant change I can see, but still थोड़ा कुछ फर्क आया था. 8.20 इसका vitamin D levels पहुंच गए थे. Then over the further course, 12th of August 2024, vitamin D levels were 25.9 nanogram per milliliter. One thing you can say कि आप लोग के दिमाग में हो रहा होगा कि सैशे भी आते हैं, तो हमने ये किया है and over almost 8 months में ये रिजल्ट आया है, right? The point is this कि ये रिजल्ट आया है तब जब हमने बाकी कुछ चेंज नहीं किया है, and जो सैशे हैं, if you know about this कि बहुत ही पॉपुलर है होम्योपैथी में. When we talk about homeopathy, we don't talk about treating vitamin D as such. उसके लिए तो लोग बोलते हैं कि जी आप सैशे ले लो. But what I have seen n number of my patients that till the time they are taking the sachet, okay, they are getting somewhere the readings are like almost sufficient or even in this range, insufficient to sufficient. But as soon as they leave the sachet, taking the whole calciferol sachets or shots, again the vitamin D levels fall down very abruptly. I've seen it in my own case also. So I started wondering why this. It should keep keep up like this only, even this with the normal routine. So this was the follow up, and till date अभी latest इसकी readings अभी नहीं है मेरे पास. Now the patient is not on this is the last reading of 12th of August 2024. अभी इसकी latest एक reading और लेनी है, and with that this case will be closed. But yes, I have seen that Calcarea carb has produced, when we read Materia Medica, we all know, we have read Kent Materia Medica, where he says about Calcarea carb that एक हमने पढ़ा था ना आर्न शूल्स लॉ कि भाई जो या आपका हॉर्मेसिस एक थियोरी है जहाँ पे लार्ज डोजेस किल एंड मॉडरेट डोजेस they produce certain genes, but the small doses, the minute doses are the ones that stimulate the system. तो कैलकेरिया कार्ब का जो बिगनिंग करते हैं केंट, वो करते ही इसी हैं कि जो बच्चा है उसको इतना ज्यादा लाइम वाटर दे दिया जाता है कि द सिस्टम स्टार्ट्स गोइंग इनटू अ डेफिसिट. वो एक उसका इनहिबिटरी इफेक्ट आने लग जाता है, एंड द पर्सन डेवलप्स द कैलकेरिया कार्ब मॉर्फोलॉजी इनटू हिज सिस्टम. So I wanted to explore this medicine, hence the study, and I have found really good results. This is one of the cases which I have detailed out here. But yes, this medicine is working very effective. I don't say that this is the only remedy. There are other studies going on, or rather, which have been conducted earlier also in homeopathy. One was done on Hashimoto's thyroiditis. That was the that was the main target of that study that I took into consideration for reference. But in that study also, they showed that with the homeopathic intervention, the Hashimoto's thyroiditis improved. But along with that, even the vitamin D levels of the patients improve. And in that study, even calcarea carb, natrum mure, CPR, these were the major remedies that were coming out as the main homeopathic drugs altering the vitamin D levels. So this is the case, and with this I lead to the conclusion. Any questions here so far? Anyone? आप लोग के कोई एक्सपीरियंस है विटामिन डी के साथ, if you have altered vitamin D levels with homeopathic medicines? Okay. So we all know a well-balanced nutritious diet and a healthy lifestyle are essential to correct nutritional deficiency disorders. पर अगर वो underlying error, basic condition सोरा की एंटी मायोस्मेटिक ड्रग्स आप नहीं देंगे तो आउटकम सस्टेन नहीं करेंगे, they won't remain for long. In this condition, once the supplements shall get used up, the body will again slip into depletion of the resources, and there's another condition that even their hypervitaminosis or hyper conditions can also result, and hypervitaminosis results in renal conditions, renal stones, developing various pathologies in the kidney also. So that is again another repercussions of taking the crude and the physiological doses of these micronutrients. Using supplements as part of a regular regime may also lead to excess of micronutrients. As I said, this case is a part of a larger study, and its aim is to explore the use of homeopathy in deficiency disorders. So with this, I come to the end of this presentation. These are the references I have taken for this presentation. That's all from me here. Any questions? I am happy to take. Yes, anyone? कोई अपने एक्सपीरियंस भी आप शेयर कर सकते हो.
Ma'am, I would like to share that nowadays I have found in my clinical practice that cases of hypervitaminosis D especially have increased a lot. So it is not just the basic deficiency कि आप धूप में नहीं जा पा रहे हैं इसलिए आपका विटामिन डी कम हो गया. It is not that. So this जो aspect आपने दिया है, एक outlook दिया है चीजों को और depth में समझने के लिए कि what are the other triggers which can lead to such deficiencies and how they are connected to the SORA. So, ma'am, this was very educative for me. And now I'm able to understand how so many of my patients are having such complaints and what are the other aspects I should look for in it. So it was very educative
Sure,
and a
ma'am.
very knowledgeable session, ma'am. And जितना अच्छे से आपने बायोकेमिस्ट्री को इसमें इंटीग्रेट किया और सारे होम्योपैथिक लॉज को एक साथ इसमें इतनी अच्छे से सिस्टमैटिकली पुट किया कि आई थिंक मोस्ट ऑफ आवर कंफ्यूजन्स हैव बीन सॉल्व्ड. And still, I request the participants if they want to share anything more.
I'm pretty sure because this is one of the condition which is so very prevalent. Every now
Yes,
and then
ma'am.
you get the patient checked up for some other thing and this thing comes up because आजकल वो पूरा complete body test और ये सारा कुछ packages जो चल रहे हैं ना तो उसमें आ ही जाते हैं ये parameters and then
Yes,
that explains the entire list of pains and reduced immunity, the hair falls and the skin issues and even the depression. Or
yes,
let
ma'am.
me with this patient also this patient was a student and I've seen so many patients who are in this age group like young adults and they have made क्या है कि हर सेट के साथ कंप्लेंट्स भी चेंज होते जा रहे हैं बिकॉज वो क्रॉनिक डिजीज का जो मैनिफेस्टेशन है वो भी चेंज होता जा रहा है दैट इज ऑल्सो मूविंग ऑन इट्स ओन ट्रैजेक्टरी और फिर वो टुवर्ड्स द ओल्ड एज वो कहाँ जाता है फीमेल्स में ऑस्टियोपोरोसिस फ्रेजाइलिटी फ्रैक्चर्स इवन विद द मेल्स वो कंबाइन कर जाएगा और हार्मोनल कंडीशंस में एंड अल्टीमेटली वो फिर that leads to greater loss. So
डेफिनेटली मैम. मैम इनफैक्ट मैंने पेशेंट्स के उसमें देखा है पर्सपेक्टिव में कि दे आर आल्सो लाइक ये तो लो आता ही है विटामिन डी बट इट इज जस्ट नॉट दैट देयर आर सो मेनी कॉजेज लीडिंग टू सो मेनी डिफरेंट सेट ऑफ सिम्टम्स इन पेशेंट्स. सो एज अ होम्योपैथ और इसको जैसे आपने कैटेगराइज किया इन इनडिस्पोजिशन एंड क्रॉनिक डिजीज इट्स डायनामिक डिजीज. सो ये हमें और हेल्प करेगा फर्दर कि हमें और केस को किस तरीके से आगे pursue करना चाहिए उसमें कि is the patient really into indisposition only or is it really a dynamic disease for him or her. So ma'am, it was very educative and very knowledgeable session जितने depth में आपने deficiencies को discuss किया and a very new concept. We have not heard much about it. So a very new and refreshing topic, ma'am.
thank you so much. Thanks a lot.
Thank you, ma'am. Thank you for giving us your time, ma'am. And now I would like to introduce our second speaker, Dr. Jaidev. Dr. Jaidev Sharma is a practitioner in predictive homeopathy, the real classical approach, practicing for last 32 years in Twin City, Yamunanagar, Gandhagri, and has recently opened the clinic Homeo Vibes in Greater Kailash 1, South Delhi. Graduate from Nehru Homeopathic Medical College and Hospital, Defence Colony, and postgraduate from Marathwada University, Aurangabad. He did an excellent work through proofreading of great teacher legend of homeopathy, Dr. Praful Vijakar's book, My Assumption, a real treatise on miasm. He has also given many seminars in Haryana, Punjab, Uttarakhand, Jammu Kashmir, Orissa, Delhi, and Chandigarh. Sir, I welcome you to our webinar series, and we are very humbled by your presence here. Sir, I would like to give you the session now. Sir, please begin your session.
Thank you. Is it visible?
Sir, are you sharing something? So you are
Yes.
visible right now on the screen.
Okay. The screen is not being shared. Give me access to share the screen. It's not being shared.
Okay, sir. Sir, are you going through that arrow on the top
Yes,
beside
share
the
arrow.
mic? Okay.
Share arrow. Share content. It is showing share content, include sound, presenter mode.
Sir, share screen option must be there.
No, share screen option is not visible as yet.
Sir, is it asking for any permission?
I am just pressing this share content. Na?
Okay.
So share content is showing include sound fine. Presenter mode,
Okay.
reporter
Sir,
side by
below
side.
that, below
Only
presenter mode.
below that window.
Okay. Below that.
Oh, nothing below that.
Let me check. Sir, beside window, on presenter, below presenter mode, and beside window, there is a screen option. Are you getting that?
Presenter mode. Below that there is window.
There is no screen option.
No. This is content only, standout, side by side, and reporter. That's it. And add background.
Okay, sir, I'll check it once.
हेलो हाँ जी ओके
Sir, please check now.
If I am trying to share, it gives this window, share content, include sound, presenter mode, window. When I click on window, it says we need permission to share your screen. Go to security and privacy, screen recording to give permission after, and start sharing.
सर उसे आप उस पे विंडोज पे गए हैं, उससे पहले आप प्रेजेंटर मोड पे चले जाइए, उस पे आ रहा है।
इसमें presenter mode, content only, and stand out and side by side, and in चार these four options, इनमें से कोई भी जो है it is not working ना। Okay, I rejoin. I just close it and rejoin.
Okay, sir.
Excuse me, ma'am. The teams of organizers.
Yes.
Ma'am, can you, I'm daughter of Dr. Jaidev Sharma. Can you please allow me to share my screen?
Okay. What is your name?
I'm Manaspita. I'm joined with by the name Dr. Jaya Sharma, but if you give me the access, then I'll be able to share the screen.
I am not able to get your name. By what name have you joined the meeting?
Dr. Jaya Sharma.
Okay, okay. Dr. Jaya, I have made you a presenter. Please check if you are able to share the screen.
Please check if the screen shared.
Yes, yes. Now it is shared.
All right. Just a minute.
Yes. Dr. Jaya, the screen is not visible now.
Yes, I'm receiving the PPT and then I'll share. Just a minute.
Okay. I request all the participants for kindly wait for another 1 minute, and we are sorry for the inconvenience from our side. And it'll take just one more minute, and we are all looking forward to the wonderful session by Dr. Jaidev.
हो रहा है बेटा? Hmm. Hello, everyone.
Good evening, sir.
Very good evening. Am I audible?
Yes, sir.
And the screen is also visible?
Yes, sir. It is visible.
No. Thank you. So, welcome you all to this evening session. And the topic today to be discussed is homeopathy and Germanic new medicine. Next slide. So, first of all, I pay my tributes to the master, Dr. Samuel Hahnemann, without whose efforts this wonderful science of homeopathy would not have been in existence today. Next. And along with that, we must be grateful to the originator of Germanic new medicine, Dr. Reich Geerd Hammer, who, with his wonderful thought process, gave birth to this Germanic new medicine. Next. And finally, my mentor and my teacher, Dr. Praful G. Vijayakar, deserves lots of words of praise because he has brought new dimensions to homeopathy as well as Germanic new medicine. Maybe the path shown by those great people had yet to face so many new researches and additions to which he had contributed to his best. Next. Next slide. So just a few words about Germanic New Medicine, which was formerly known as German New Medicine, is a holistic medical system that was developed by Dr. Hammer in 1980s. It offers a unique perspective on the origins of disease, proposing that physical ailments are the result of unresolved emotional conflicts rather than mere biological or genetic malfunctions. So this approach has sparked both interest and controversy in the medical community, making it fascinating subject for those who explore natural and alternative healing methods. He developed GNM after experiencing a profound personal tragedy. In 1978, his son was shot while traveling in a sea. They were attacked by some pirates, and in the exchange shot fire, his son was shot and subsequently died, leading Hammer to develop swelling in his right testes, which was diagnosed as testicular cancer afterwards. This experience led him to hypothesize that his cancer was directly related to the emotional shock and grief he endured. Intrigued by this connection, he began to investigate the relationship between emotional trauma and onset of disease in his patients. He had a data of 40,000 cancer patients with him. He was an oncologist by profession, and he retrieved the whole data and analyzed and reanalyzed it and found that whosoever had lost his offspring was liable to develop some pathology in testes or ovaries. Next. Then he formulated certain laws, which he gave the name of 5 biological laws, which form the foundation of GNM. These laws, they describe how diseases originate, progress, and can potentially be resolved, all within the framework of the mind-body connection. These laws are central to understanding how GNM views disease and healing. Each law describes a specific aspect of the disease process and how it relates to emotional conflicts. Next. According to this law, every disease originates from a DHS, Dirk-Hammer syndrome. And this DHS is an unexpected, highly acute, and isolating conflict shock where the patient is off his guard. The location of the disease within the body corresponds to the specific nature of the conflict. For example, a conflict related to self-worth may manifest in bones, whereas a conflict related to separation might affect the skin. GNM posits that diseases occur in two phases, the conflict active phase and the healing phase. During the conflict active phase, the individual experiences stress leading to changes in the body, such as tumor growth or tissue loss, either tissue gain or tissue loss, cell gain or cell loss. Once the conflict is resolved, the body enters the healing phase, during which symptoms such as inflammation, pain, and fever may occur as the body repairs itself. The third law is the ontogenetic system of tumors and cancer equivalent diseases. This law describes how the brain controls the development of diseases in different organs. Based on embryonic germ layers, according to Hammer, diseases affecting organs, they are derived from the same germ layer and they share common pattern of conflict and healing in all human beings. The fourth law is the ontogenetic system of microbes. In GNM, there is a theory that microbes such as bacteria, fungi, and viruses, they play a supportive role during the healing phase of a disease. Rather than being the cause of disease, they are seen as biological helpers that assist in tissue repair and restoration after the resolution of the underlying conflict. Fifth law is the law of quintessence. This law emphasizes that diseases should not be viewed as malicious or random, but as part of nature's biological program designed for survival. Hammer believed that understanding and addressing the emotional conflicts underlying disease could lead to true healing without the need for aggressive medical interventions. Now, this is the compass of Germanic New Medicine, which basically gives two indications. The upper one shows the germ layers and the control of their functions by part of the brain, by respective parts of the brain. So cerebral cortex and cerebral medulla. Whenever they have an impact, and the impact is represented in the organs controlled by these two, there is always a cell loss. And there is ulceration and necrosis. That is why in endothelium, lung endothelium, whenever there is lung carcinoma, it is a squamous cell carcinoma, which later on goes into ulceration and necrosis. Whereas the organs which are represented by and controlled by cerebellum and brainstem, whenever they are affected, they go into a cell proliferation, that is a tumor formation. And that tumor formation usually is a growth in the cells, in the cell mass, and it does not usually lead to this ulceration or necrosis. And then we have this representation of the two types of phases, a day phase and a night phase. And the day phase is known as sympathetic hypotonia, whereas night phase is known as vagotonia. These two have totally different types of functions. We know we have our autonomic nervous system in our body, which has two parts, sympathetic and parasympathetic part. And whenever sympathetic part is activated, we have a different physiology. And whenever there is a activation of the parasympathetic part, we have a totally different type of physiology. Next. So what is a conflict? Everywhere conflict is the term mentioned in this GNM. So conflict basically is a perception. It's an altered perception which is arising from opposing interests, values, or actions between individuals, groups, or entities. It encompasses disagreement, tension, or discord that can escalate into confrontations or disputes. It may stem from various sources, including competition for resources, differences in beliefs, misunderstandings. They can occur in personal relationships, workplaces, communities, or on a larger social scale. Next. The role of emotional conflicts in disease is not merely psychological, but have a direct and measurable impact on physical health as well. Dr. Hammer suggested that each type of conflict corresponds to a specific area of the brain, which in turn influences a particular organ or tissue. And this brain organ connection is critical in understanding the onset and progression of disease in GNM. He called it a psyche brain organ axis. Next. For instance, GNM practitioners believe that breast cancer may be linked to a nurturing conflict, such as a deep concern for a loved one. Similarly, lung cancer could be associated with the fear of death or suffocation. By identifying and addressing these conflicts, GNM aims to reverse the disease process and restore health. And when we incorporate this GNM in our practice, we come to a totally different and more mathematical approach. The diagnosis and healing in GNM, it is not based solely upon physical symptoms, but on a detailed exploration of the patient's emotional history and conflicts. Practitioners of GNM seek to uncover the DHS, the Dirk-Hammer syndrome, that triggered the disease, which often requires in-depth conversations about the patient's life experiences, stresses, and unresolved traumas. Once the conflict is identified, the goal is to resolve it, allowing the body to enter the healing phase. This may involve therapeutic conversations, lifestyle changes, and other interventions aimed at reducing stress and promoting emotional well-being. This resolution of the conflict is considered a pivotal movement in the healing journey, as it signals the beginning of the body's natural recovery process. We as homeopathic doctors treat our patients by taking a full detailed history and administering the right kind of simillimum, the right chosen remedy, and the curative action follows. Whereas in GNM practice, they basically concentrate upon resolving the conflict that is behind the whole pathology, and they try to make the patient understand that this conflict is behind the whole pathology and you have to resolve it personally. And when the patient starts resolving, avoiding that conflict, then the journey to cure starts. And so many cases are there on record where GNM followers have been able to reverse the whole pathology and to cure the patient of very serious illnesses. So like homeopathic aggravation, during the healing phase, patient may experience a range of symptoms, including inflammation, fatigue, and fever. GNM views that these symptoms are positive signs that the body is actively repairing itself. However, this phase can be challenging, and support from a knowledgeable practitioner is often necessary to navigate it successfully. So we talk of a morsel. We know that morsel of food is a handful of piece of food that we are able to eat, chew, and swallow. So metaphorically, this morsel has been related to a job, business, position, promotion, purchase, or something that one strongly desires but is unable to grab it. So it could also relate to an apology or proposal that was expressed too late or something that was too slow to get rid of. In children and young adults, drive of competition and the constant pressure to keep up in the job or school or business evokes this conflict. So whenever there is some indigestible anger, a person says that I just could not take that. So that basically was an indigestible morsel for him. If he was maltreated by someone, if he had some unexpected remarks by someone, then it could just act as a morsel which is indigestible. Next. So all these 5 biological laws where every disease stems from an emotional shock impacting the psyche, brain, and organ simultaneously. So the axis is followed, and then it has 2 phases. Then the location and nature of disease, they are determined by the conflict and the affected brain area. And they say that microbes, they act as scavengers, and the diseases, they are meaningful survival programs which are helping the body to adapt the conflicts faced. Next. This is a diagram of cut section of brain, diagrammatic representation, which basically shows both the right and left parts or the hemispheres of brain, and correspondingly the areas being represented in the brain, the different parts of the body being reflected in the brain, and these are the areas which are vulnerable to the conflicts, and the area which becomes affected, basically the organ where this area is representing its control, that area will get affected. So these areas, you can just go through this image. This shows on the left side, there is motor area for right leg and right foot. Correspondingly, on the other side, there is motor area for left leg and left foot. So whenever there is a conflict of day-to-day work or walking, that conflict will affect this area, and in the body, the leg or the foot is the part that will be affected by the pathology. Next. Same ways, we have different kinds of conflicts I'll come to later. Whenever there is a severe self-devaluation conflict, it is going to affect the organs that are arising from the mesoderm, the sclerotome, myotome, dermatome. So whenever this skeleton gets affected, there is always some severe self-devaluation conflict responsible for this. So different parts of body with different bony structures, they are liable to get affected. Whenever there is lumbar region getting affected, we know lumbar region is for support. That person is feeling unsupported or shattered, and there is some humiliation. He is feeling debased. When such a kind of conflict is there, the lumbar area is bound to get affected and he will have a lower backache. Whereas whenever there is cervical or the neck or the cervical spine involved, there is some injury to the respect in the work area, some intellectual area, some workplace where he is being showed down upon by someone. So his respect, his identity is getting affected, and he is bound to have an impaired immunity in the cervical spine and will lead to early cervical spondylotic changes. Next. This all depends upon individual perception. Person to person, it differs. Every person is not going to take the same conflict in the same manner. So what is the difference between stress and anxiety? It is important to know between the difference between these two. Next. So stress is a physical change that takes place in the body, occurs because of different stress factors, include meeting new people, being physically threatened, can be measured by measuring changes in the levels of stress-related hormones in the body. They control human behavior in response to a specific stress factor. Anxiety is a feeling of unease or of being overwhelmed, or we call it as ready to fear. It usually results from being afraid of something. For example, it is common to feel anxious about an upcoming test because you are afraid of failing or doing poorly. It is a negative feeling in response to stress. So basically two types of stresses are there. One is eustress, which is a positive stress, and the distress, which is a negative stress. For example, imagine when you are playing a video game, the game simulates a predator-prey relationship or fighting. You are trying to tag someone while trying to avoid being tagged yourself. This triggers your fight or flight response from the adrenals, ACTH, coming into action. When playing the game, you will naturally become stressed. Your stress hormone levels will go up, causing you to be more alert and active. In this case, stress is beneficial. But having a constant increase in stress levels can actually lead to depression and mental health issues. That is why it is very important to know different types of stresses. So acute stress is episodic stress and chronic stress is toxic stress. Next. And eustress is the most common form of stress. You may feel it before performing in front of people or taking a test or after having an argument with someone. The factors that lead to eustress only result in short-lived changes in stress hormone levels. This type of stress does not last long and will not have any long-term negative effects. Basically, it is thought to be necessary for healthy development. This is because it teaches the brain how to respond to stress in a healthy way. However, being exposed to any type of stress for a longer period of time can lead to serious health problems. It may be acute or chronic, as I told you earlier. Acute stress is caused by events like loss of a friend, a family member, breakup of a relationship. They have greater impact on the body than everyday stress. If they are not managed properly, the stress from these events can lead to negative brain changes. However, this can be managed if you are in a supportive environment and have positive interactions with others that help to decrease the stress levels. Whereas chronic stress or toxic stress is often the most long-lasting and damaging form of stress, caused by stress factors such as physical or emotional abuse, bullying, neglect, and addiction. Toxic stress can lead to lifelong physical and mental health issues. They occur because the stress changes the way that the brain communicates with itself and the rest of the body. So basically, it's a hypophysis pituitary axis in the brain. The impact is in the brain, the emotions get upheavaled, and it just leads to certain changes in the hypothalamus, which in turn acts upon the target organs like adrenal glands, which releases cortisol, which gives us more power and energy to combat that particular situation. And the physiological changes that occur in the body, liver converts glycogen to glucose to give more energy. There's decreased digestive system activity so that you feel just not like you don't feel like eating. There's some anorexia, and there is a rise in the blood pressure to make more blood reach to brain as well as body. There's increase in the heart rate. There's dilatation of bronchioles. Next. Next. So basically, it's a very intricate mechanism in the brain. Whenever there is stress, lots of chemical changes are there. And this basically shows the basic approach. They call it, GNM people call it as SBS, a significant biological spatial program, which causes a conflict shock, which again affects the areas, corresponding areas in the body. And there is one more factor, the deciding factor, that is the handedness, which decides that upon which side the effect of that conflict will be shown. Next. In our homeopathy, we have rubrics, beautiful rubrics, so beautifully arranged in our repertory. Whenever we go to mind section, we have a rubric ailments from. And these are the very common, one of the common, last slide. Okay, next slide. Next slide. This basically should have been the previous slide. Anyhow, ailments from being alone, the ambition deceived, anger vexation, anger suppressed, bad news, business failure, cares and worries, contradiction, death of child, death of parents, disappointment, domination, a long history of domination by others, embarrassment after ailments, financial loss, friendship deceived, fright or fear. These are all rubrics given in the ailments under the section of ailments from. The main rubric ailments from. These are the sub rubrics that we usually almost day in and day out, we use them in our case taking in cases, and to select this causa causalis, the basic cause, we have to rely upon these rubrics. Honor wounded, indignation, insults and offenses, disappointed love, mortification. The previous slide. Then we have position, job, loss of, some punishment, quarrels, reproaches, rudeness of others, scorn, being scorned, sexual abuse, shame, shock, and pleasant surprises. Next to next. So basically, we live in a society and we do come across people who really are not nice at times, and they do say something which can really hurt. So words can really hurt, so always say something nice. Next. Then we have a full chapter dedicated in our mind section of repertory to these delusions. Delusions, they basically include not only the false beliefs or the illusions or hallucinations, but they also include the perceptions, the false perceptions and the thought processes. This is very important because whenever a person perceives something, he has an altered thought process, and how he takes that conflict or that brunt or that insult is very important. And his interpretation to that conflict is basically reflected in these delusions, the altered thought processes, and in turn, the rubrics which we have to look for or sort into the mind section of our repertory. And these are one of the common delusions, very common delusions that we come across, and we should have this list with us always at hand so that the common delusions should never be missed. And we have 37 pages of delusions in the repertory with almost thousands of them. And of these, very important ones are delusion he is not appreciated, delusion he is arrested, he'll be arrested. There are some conspiracies against her, that he has committed certain crime, that he's a criminal, that he is criticized, he is deserted, forsaken, he's he'll receive some injury, he is being mocked at, being laughed at. Next. And he has a misfortune, he's inconsolable over that he'll be murdered, he has neglected his duty, that he has offended people, that he is persecuted, has been poisoned, he is possessed, pursued, family will starve. Now this family will starve. Whenever this delusion is there, and this delusion is very important whenever there is some liver complaint, liver ailment, because liver is the energy house, energy store of our body, the ATP-ADP reaction, ADP-ATP reaction going into liver. So whenever there is a foreseeing that I may not starve, my family may not starve, I may not become financially poor, the liver is bound to get affected. There will be hepatomegaly, there will be more accumulation of fat, fatty liver, hepatosteatosis, which will be evident on the ultrasound. So this is very important. Same ways we have other delusions like being tormented, being unfortunate, that he has done something wrong, that he has suffered from something wrong, suffered wrong. These are all delusions which are very important, and they basically at times are the deciding factors, because these are the thought processes. We take one ailment from, we take one delusion, and we take the makeup of the patient, the physical, the mental, the psychological makeup of the patient, along with his thermal, thirst, cravings, desires, aversions. And we usually are able to reach the minimum in a very fast manner. Next. Now, this is a very important factor. The handedness or the laterality or the sight. So our handedness is determined literally the moment we are conceived. And although we can train ourselves to use the left or right hand, our true laterality is really dependent on how our brain is wired. We see that certain children, they are left-handed, but they are made to work with right hand, with the writing job is to be done with the right hand, so that they may not face any difficulty in future. And these left-handed people are made right-handed, but basically genetically their brain is wired as left-handed only, and that can be decided by certain tests. Next. Whenever we have to decide that whether the person, the patient who's sitting in front of us is left-handed or right-handed, we may ask him to clap. The person who claps with right hand above is right-handed person, and the left hand above is a left-handed person. If that does not work, at times they clap with both hands in the center, then we can ask him to open a cap of a bottle. The hand which is being used basically reflects the laterality of that individual. Next. So in this laterality, we are able to decide the cause of the conflict. The right side is said to be the partner side. So any conflict with the partner, Any conflict with father, spouse, or business is bound to produce a disease on right side of the body. Whereas any conflict with mother, children, siblings, home, pets, pet project is liable to produce a disease on left side of the body. So left ovarian cyst, left breast fibroadenoma, they have something to do with mother, children, or siblings. Whereas squint in right eye, hernia on right side, and even ovarian cysts on right side, they have to do something with spouse, partner, father, husband, business. So this is to be kept in mind. And this is again very important. You can straight away pinpoint that this particular disease is due to something related to the family, not related with the business. Something related with siblings, something related with a blood relation, and not with the non-blood relation people. That is uncle, aunt, cousins, in-laws, not with that. So you are almost sure of this. And accordingly, you can probe the case deeper and even deeper to reach the right conclusion. Next. So we come to certain conflicts. The common conflict types which we come across in day-to-day case taking, they are, next, self-devaluation conflict, territorial conflict, abandonment conflict, indigestible morsel conflict, identity conflict, starvation conflict, separation conflict, nest worry conflict, profound loss conflict, morsel conflict, death fright conflict, and wrong direction conflict. Whenever these conflicts are there, you have to pinpoint the particular conflict and the details about these conflicts. They are given in certain books, in certain sites. You can go through the details of these conflicts in those particular texts. I'll just touch a bit of that. A few lines about every conflict. Next. So self-devaluation conflict can be divided into these four parts: intellectual self-evaluation conflict, central, localized, and slight or light self-devaluation conflict. Because these four different categories are the factors responsible to decide whether the disease will be there in the bones or in the muscles or in the dermis. So these things, or in the lymph nodes even, or in blood. So they are very important. The depth of the conflict will decide the depth of the organ involved. Next. So basically, it relates to a poor artistic or athletic performance. For example, it corresponds to the hands and legs, a self-devaluation conflict brought on by a cancer diagnosis will, or a negative prognosis, or a continuous localized pain. It correlates to the nearest bone or joint. In shoulder joint involvement, we know that the conflict is related to responsibility, because we shoulder a responsibility. The shoulder represents the responsibility. So whenever there is a right shoulder being involved, we know that the responsibility we are not able to shoulder is related to the spouse or the business partner or father even. Whereas whenever there is frozen shoulder on the left side, we know that the person is not able to carry the responsibility towards his or her mother or siblings or children. So this way you have to decide the side affected and the site affected and the conflict involved. Next. Abandonment conflict is a kind of a refugee conflict. Whenever one feels that he has been abandoned, he has been left out, he has been deserted. And here, basically, the organ involved is parenchyma of kidney. So in the cases of CKD, in the cases of chronic renal failure, we have to just search for this particular conflict, because usually without this conflict, kidneys, they do not go into failure. Next. This is another conflict, identity conflict, where an unwanted move, a change of school, a change of a workplace can activate this conflict. Feeling unsettled, not knowing where to belong, not finding one's place in a relationship within the family, where the identity is at stake. In a culture, in society at large, as well as discrimination against one's beliefs or sexual orientation, they are the examples of what can evoke an identity conflict. A female child being brought up like a male child, this conflict is almost sure to occur in that particular child. Next. And we do have rubrics for that as well. Whenever a female child is brought up like a male child, we have a rubric, masculine rubric, man in the repertory. For females, we have effeminate, and for males, we have mannish habit in girls. So these are very important rubrics. Whenever there is an identity confusion, these rubrics are used beautifully. Next. Indigestible morsel conflict. As I told you, morsel is something we take inside, and whenever there is an indigestible morsel in the form of an anger or about a situation related to certain remarks or criticism or accusations or insults, which are hard to digest, this particular morsel, they come into play. Next. Again, abandonment conflict. Next. Leave that. Existences for fear of one's life. It's like a fish out of water in danger of dying. So the fear, whenever there is some loss of workplace, financial loss, loss of a home, loss of a person who provides security economically or emotionally, the existence conflict comes into play. Next. This is again a refugee conflict. I had already talked about. It's a kind of abandonment conflict only. Next. Death threat conflict. This gives rise to when one is not able to inhale, that he has the fear that I am about to die. That basically changes the immunity at the lungs, and the respiratory system gets involved. And we have bronchial asthma. Next. 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 This is again ball and chain conflict. When one is not able to move, one is shackled to a place. The varicose veins, they are the outcome at times. Next. Next. So we have to frame our questions accordingly. The next slide, you can just take an image, take a pic, because this is again very important. In a case of PCOD, which is very common nowadays, we have to frame our questions in a manner so that we don't miss anything. Next. These are the different factors, and every one of them is important. In an unmarried girl and in a married girl, in married lady, whenever there is PCOD, we have to just fish the symptoms or the causes accordingly. Next. So the next section basically follows in the form of mind of organs and disease. So because this again is a lengthy chapter, so I think we can take it sometimes later in the future whenever the time and the occasion permits. So here I would like to conclude by saying that in homeopathy, we know what is the importance of causation, and exact causes can be ascertained by having a good knowledge of GNM and the thought processes behind will lead to a particular involvement of a particular organ with a particular pathology. That again is a beautiful mathematics. So Dr. Vijayakar used to say that homeopathy is mathematics. And this particular saying was every time proved by him in his different kinds of cases, incurable cases. So when he incorporated GNM in his practice, he was more sure and sure shot of the pathology, the process, the thought process, the pathology, the manifestation, the information being given to the body by the brain, and finally deciding upon the right kinds of rubrics with the selection of the right kind of genetic constitutional and minimum, and by being administered, this remedy being administered to the person, he used to show the reversal of the symptoms with a clear reversal in the form of Herring's law of cure, and the permanent cure was possible only by following these particular methods. And I hope most of you are aware of the predictive homeopathy, the teachings of Dr. Vijayakar, and if you just conjoin this GNM with that, you will be a totally different kind of practitioner, a totally different homeopath, finding it very easy to cure the incurable cases, the irreversible pathologies. Thank you.
Thank you, sir, for a very insightful session. Uh, Sir, I myself is a big believer of the Germanic new medicine and hammer theory, sir. And this was आपने जो दिया, it was like a summary to a very big theory that is given, and you have very wonderfully explained all the aspects of it, like all the laws, all the 5 laws, the literality, the relation to embryonic germ layer, and the relation to the left side, right side of the body, as well as all the different types of conflicts. It was a very wonderful session, sir. I think Germanic New Medicine is one topic which is very underestimated or very less showcased and not very popular amongst many homeopathic physicians. And especially as a beginner and a new practitioner, I think everyone should at least read Germanic New Medicine or Hammer Theory at least once in their, course of practicing. So it was very great and amazing session by you, sir. And
Thank you.
yes, sir. And sir, इससे आई थिंक कोई और होम्योपैथ डॉक्टर हैनीमैन की थिंकिंग से इतना ज्यादा लिंक नहीं किया होगा, कोई और फिजिशियन या कोई और थ्योरी इतना ज्यादा पास नहीं आई होगी जितना कि डॉक्टर हैमर की ये थ्योरी आई है.
Yes.
सो डेफिनेटली इसको जो राइट क्रेडिट है वो मिलना चाहिए. अभी भी बहुत लैकिंग है इसमें. एंड थैंक्स टू यू सर एंड थैंक्स टू प्रेडिक्टिव होम्योपैथी और ज्यादा इसको लाइट शो हो रही है, हम लोगों को पास तक पहुंच रही है, हमें राइट इसकी इंफॉर्मेशन मिल पा रही है. सो थैंक यू सो मच सर फॉर द वंडरफुल सेशन.
Thank you.
एंड सर डेफिनेटली हम कभी और आपके साथ लंबा टाइम लेके इसको और डिटेल में स्टडी करना चाहेंगे, बिकॉज ये बहुत बड़ा टॉपिक है.
Yeah, it was just a gist.
Yes, sir. Thank you so much, sir. Thank
Thank
you for giving us the time, sir.
Thank you. Thank
And any participants, if they want to ask any question?
Any questions? Yeah, any questions? Yes.
Hello, sir. Sir,
Hello.
you resolve these traumas then when you identify, then how will you resolve? Suppose emotional trauma है, suppose loss of father है या loss of son है, कुछ भी है या कोई और trauma है, तो how will you resolve them?
You have to make the person, the patient, understand that the suffering that you are facing is basically due to this particular trauma which has affected your thought process, which has brought certain changes in your chemicals of the brain, in the neurotransmitters, and in turn, the target organs and their functions. And that can be restored to normal when you yourself try to resolve this particular conflict by yourself. And if you are not able to, then you can come to us and we can, by whatever approach we have, we try to resolve the conflict in you. And that is where the homeopathy has an upper hand. You don't have to make the person understand that this is the conflict you are facing, you are suffering from, and this is the disease, this is due to this particular conflict. You just give a dose of the right remedy and it does the rest of the job. GNM people, they make the person understand that you resolve yourself, you just come out of this conflict, and the path to recovery starts. And in homeopathy, we administer the right kind of simillimum, and it takes care of the whole economy. It changes the thought processes as well. This is the only science on earth, the only pathy on earth which has its access to all these three levels: the psyche, the brain, and the body.
Thank you, sir.
Welcome. Any other questions? I have not included any cases because that could have taken even more time. But because we should know the approach, we should know the common rubrics we have to use. We should know the ailments from by heart. We should know the these delusions or the false beliefs or the perceptions. So basically, whenever we have to go by this, we have a situation in a person. This situation basically affects the brain. So how that person perceives it, that situation, it differs from person to person. And then what information is being supplied to the brain and then in turn to the target organs. And then what is the manifestation? That how this whole story is being manifested in the person, in the patient. And then we have to go for the right kinds of rubrics. We have to take those rubrics out. We have to just list them and then finally decide upon a remedy and then administer in the right potency and dosage. And then we should have a follow-up, a nice follow-up, which basically leads to the real path of recovery or cure that every one of us longs for. There was a question where we should get this knowledge of GNM from. There is a site, www.learninggnm.com. This basically gives the basic idea about GNM. It's very detailed, it's beautiful, it is covering almost everything of our brain and body. What I would like to add is Dr. Vijayakar has added even more colors to it with certain new dimensions, which really cannot be shared right now at this platform, because that basically is again very deep study. Like if a patient, a lady has a lump in breast and it is diagnosed as fibroadenoma, fine. There's a lump in breast. So when the lump is there in the left breast, the cause has to be different. And even in the left breast, if the lump is in the upper medial quadrant, the cause is different. Upper outer quadrant, lateral quadrant, the cause is different. Lower inner quadrant, cause is different. And outer lower quadrant, the cause is totally different. Same ways, whenever there is a lump in the right breast, upper medial quadrant, it is totally different cause. Lateral quadrant, another cause. Medial lower quadrant is a different cause, and lateral quadrant, lower quadrant is a different cause. So that ways, the 4 plus 4, 8 quadrants of both breasts, they have different types of causes responsible for the lump. See how beautiful and intricate the whole mechanism is. Same ways, if a person has squint, either in left eye or in right eye, whether the squint is esophoria or exophoria, that is outward or inward, the causes are different. For all the four types, both iso, exo, in both eyes, the causes are totally different. The causes for heart are different, for liver are different. Heart situated on left side, liver situated on the right side. They are different. So, Dr. Vijayakar has gone in even into much more of depth, and he has created a beautiful relationship between homeopathy and GNM. Every tooth of the 32 teeth has a different cause for its ailment or illness. So that is every finger of our hand has a totally different representation, different kind of conflict, different kind of reflection of our thought process. Every toe of our foot, right, different, left toes, all the 5 toes have different kind of causes behind them. Different kinds of thought processes, different kinds of conflicts, different kinds of perceptions. Right? So you can just go through the basic details, and whenever you feel like, even I would intend to make a platform of learning in Delhi whenever it is possible, and we can just join together and have a meeting where we can further study this GNM in depth. The basics, they are almost have been touched by me, and they are very clear by the site, this learning GNM. We should be very well versed with this psyche, brain, and organ or body axis. And we should be very well versed with the vital force, with the different kinds of pathologies, the different types of rubrics in different sections of our repertory, where we have to take into account the parenchyma kidney rubric, where we have to take into account the growth arrested, where we have to go for softening of brain, where we have to look for relaxation of muscles. These are the rubrics present in our repertory, and they are used in very grave diseases like myopathy, like cerebral palsy, like uh, mental retardation, like Down syndrome, all those irreversible pathologies. We have to take these kinds of rubrics into account. The thought process of the mother during pregnancy, her perception, her information supplied to the fetus, and the manifestation of those congenital anomalies in the fetus. They can only be reversed when we are well aware of these thought processes, these perceptions, these manifestations, the rubrics contained therein to be used, and the right remedies arrived at. Any other questions? Hello.
I think, sir, there are no more questions right now. And definitely, sir, we will look forward to more detailed sessions of GNM from you. And thank you so much for this insightful session. And sir, I would like to add one more thing. Dr. Rohit Bhandari has sent his sincere apologies. He got busy in some urgent circumstances and he could not join today. But he asked me to tell you that.
Okay. No problem. We'll talk later. Huh? I'll just talk to him later. Sure. We'll have an exchange of words later. Right.
Okay. Thank you so much, sir.
Thank
Thank you. Sir.
Okay.